Okay. Well, again, thanks for your patience. I'm not used to being late for talks, sitting in my own chair at home. Um, so we are basically going through this about the two mRNA vaccines. I'm sure I have a sense this audience maybe has followed this pretty closely. So obviously, they're both kind of the same, biological process being followed, with some details that are different. But both the Pfizer and BioNTech and the Moderna vaccines are based on messenger RNA. And of course, as you know, we have an emergency use authorization for both of them. Um, so Pfizer is the two doses, 21 days apart, and that's give or take. You can't do it earlier than 19 days, or for Moderna, they say 4 days either way. But just a reassurance, if by any chance your second dose was held up and you went back in 6 weeks or 8 weeks, we'd still give you that second dose and we'd expect pretty much the same result. You just would be not fully protected for all that time. As you know, both vaccines were tested in a lot of diverse adult populations. I think they did quite a good job, including older adults and various communities of color. Native Americans were in there. It's pretty diverse. So messenger RNA basically, just tells our cells to make this spike protein, which as you've all seen the picture of the SARS-CoV virus, and it's got the red dots on the end. So that's the spike protein. So it makes the spike protein, which then triggers an immune response in our body, which produces the antibodies. It can't give you COVID-19 because there's absolutely no virus in the vaccine. There are other vaccines that are made with live virus, or parts or killed virus. There's no virus, even parts of virus in there. It's just the spike protein. The messenger RNA gets in our bodies and it doesn't change our DNA. It actually just gets absorbed and destroyed into in the body. And mRNA technology is relatively new, but it's not brand new. It was used for Zika and some other vaccines and therapeutics. So it's not fresh. It's not out of nowhere, even though we probably didn't all hear of it. So how did they do it so fast? First of all, they used existing clinical trial networks to start with the vaccine trials. They didn't start from zero. They didn't have to build up from recruiting 30 or 40,000 people from scratch. And then you probably heard that manufacturing was going on parallel to the clinical trials, and that's not normal. What's normal is you get your clinical trials, you get approval, and then when you know it's a sure thing, you start manufacturing because nobody wants to waste that money. Well, this time the government underwrote that process, and they were able to do it parallel. Also, mRNA, the messenger RNA technology is faster. You're not growing, culturing on eggs or other media. It's just a pretty fast production technology. And then, of course, the regulating bodies, FDA and CDC, basically prioritized the review, authorization, and recommendations. They had people lined up on Friday, Saturday, holidays to get these through. So I think to say it wasn't rushed, but it was done as quickly as you could and still do everything right. And I really do think, they resisted further political pressure to do this in a much more hurried way, and they resisted that, and they did it right. And I'm really proud of our systems. Okay, how are we monitoring safety? So we've got this classic one. It's called VAERS. Everybody in the immunization community knows about VAERS. It's been around for a long time. It's a vaccine adverse event reporting system, and it's basically like red lights on a dashboard that collects reports. And if they cluster enough and see enough of a pattern, from healthcare professionals, manufacturers, anybody else, public, that's when they might step in and stop a vaccine, or they might require them to do some other work or something like that. So we have VAERS, and we've had that for ages. And then they have this new system called vSafe, which is a smartphone app. And that's cool because it gives you such thing as second dose reminders, telephone follow-up to anyone with adverse events. It's text messaging and web surveys to check in. So it's pretty comprehensive. So when you get up to getting a vaccine, that should be offered, although I've heard it's not always, but you can look it up here. You can look it up online and see VSafe, and get that downloaded on your phone. So next generation safety monitoring. All right, so the phases came out, right around Christmas from the federal government, basically from the ACIP, the Immunization Practices Committee. And they do all the vaccines. They're the ones who tell us how many doses of HPV you need, whether this vaccine can start, who it's for. So New Mexico took it and kind of changed things around. So phase 1 is about the same, phase 1A, sorry. Phase 1 is healthcare personnel. It's long-term care facilities, both residents and staff. And then we've also got in there congregate care workers and home health care workers and hospice. So we added those into phase 1A. Phase 1B is a huge phase. So it was originally, the federal government put that as 75 plus and age 75 and up, and frontline essential workers. So it's interesting. I read the ACIP and listened to some of the ACIP deliberations, and they talked about we're looking at two angles on this. One angle is protecting vulnerable people. So if you're over 75, if you're in a long-term care facility, you got a lot of people around you and you're elderly. These are the highest risk folks, right? So they wanted to protect them. But then the other one was protecting crucial parts of society. So healthcare workers, they're not at highest risk by any means. They've got their protective gear. They're good, really. I mean, they had cases, but they were nowhere near as high. But we're protecting them because they're crucial infrastructure that we need to keep the healthcare system working. And the same is true with these frontline essential workers. So, your teachers, your daycare givers, your grocery store workers, for goodness sakes. We all need to eat, right? Food and agriculture. So public transit, not so big in New Mexico, but in a lot of other states, that's just a lifeline. So they're protecting them. We also added in here the 16 to 64 people with underlying conditions, chronic conditions, complications that make you really at risk. So there's a long list of everything from diabetes to heart disease to just a number of chronic conditions. And then so that's phase 1B, and it's a big, it's well over 500,000 people. Phase 1C, we haven't gotten there yet. And I should say, where we are now is we're kind of in between phase 1A and 1B. We have transitioned to 1B, but we're still getting 1A folks who either didn't get a chance to get a vaccine, or maybe they said they didn't want it, but now they reconsidered. And that happens. People say, nah, I'm going to watch and wait a little bit. And then it comes around and they go, yeah, okay, I want it now. And then we're also in 1B, and we're trying to work our way down in order from the 75 and older, the persons 16, the folks with the complications, the underlying conditions, and then down to the workers. Folks, I'm going to tell you right now, it is not linear. It's just not linear, okay? There are so many angles, there's so many contingencies that can come up from everything from leftover vaccine, once you've already vaccinated the people in line, to just needing to, people in a given area of the state running through the phase 1A and having to reach 1B next. Or not enough people in 75 and older getting in yet. And I'll show you some data on that in a minute. And then we got 1C, which is 60 plus and other essential workers. So then phase 2 will be kind of the rest of us, everybody else. This is the registration system online, and I'm sure If I was in a live audience, I'd be asking you how many of you have done this, and I bet you mostly you have. Um, that's how we're really funneling people into slots for vaccines. It's not a perfect system. It's sometimes frustrating, but I got to tell you, people, we're in the top five number of states in the nation for getting out the percentage of vaccines that are given to us, actually getting those into arms. So obviously, if you come in and register, you can then be called up. It basically puts you in the waiting room. I'll put it this way, because there's basically 10 people waiting for vaccines for every one vaccine we have. So this will put you in the waiting room. It'll put you in line, and you will get, called up either sooner or later. So we'll talk more about the app. I'm sure you'll have questions about it when we get through. Um, so what happens when you get in there? You get hopefully information to sign up for VSafe. You're going to get your shot, and then you get monitored for 15 minutes, unless you have greater risk factors, which we'll get to in a second. You'll get a pain in the arm where you get a shot. Sometimes redness or swelling is pretty common. It's usually mild and gets over and is done after a day or two. And then you can have fatigue, muscle aches, chills, headache, fever, nausea, and it's more in Moderna than Pfizer, a little bit, not a huge amount, but a little bit more. And it's more in the second dose than the first dose. Um, it's usually mild to moderate, resolves in a couple of days. That is your body kicking in the immune response. So say thank you, but ouch. It can be a little bit unpleasant, but it can also be not too bad. All right, the ones we really want to watch out for are people with anaphylactic shock or anaphylaxis reactions to severe allergic reactions. That's what our big thing that we know. And big, when I say big, is that it's serious. It's not very common. So I was given the stats that there were 21 of these out of the first 2 million in the country. So it's extremely rare, but it's serious, and we want to take care of it. So if you have severe allergic reactions to any of the ingredients, which are listed down here, you can probably want to not get the vaccine. Folks with allergic reactions of that kind to other vaccines or other injections, what we're going to do is we're going to observe you for 30 minutes following the vaccination. So you'll stay and get observed. So we make sure that nothing serious happens. Folks that do have severe allergic reactions, have had anaphylactic reactions to other vaccines or other injectables, probably want to get your vaccine at a hospital or another advanced medical care system where in case something happens, they could handle that and make sure nothing goes negative there. And if you've got that kind of a reaction, an anaphylactic reaction to the first dose, they're going to say, please don't get the second one. And you would probably say, I don't want it, thank you. Okay, just a few more things. Vaccines are not interchangeable. You got to get Moderna, or Pfizer. Shouldn't be administered with another, you shouldn't get Shingrix and then within 14 days get another one or some other vaccine, MMR. We can give it to people with underlying health conditions. In fact, that's who we absolutely want to get. That's a high priority vaccine because you're at greater risk for disease. And folks who have autoimmune conditions, we don't have a lot of data, but we're saying do get the vaccine. Talk it over with your provider if you want. And the same is true of pregnant or breastfeeding women. You know how they say pregnant or lactating people? I don't know. I'm going to just go with women on that one. I'm sorry. I'm old fashioned. Okay. Again, just to stress the fact, the vaccine cannot give you COVID-19. I think that's pretty clear. It does take a few weeks, though, for the body to build up immunity. So a person could get their first vaccine and then get infected around the same time, and it might look like it, but that's just because you weren't fully protected. It does take a few weeks after the second vaccine to get fully protected. Okay, a little bit of a myth. Some folks think natural vaccination is, natural protection from getting the disease is better. It's not better because there's the risk of serious illness or death. And we don't know how long that's going to protect you. But we're just saying it's better to get if obviously if you did get COVID, we're also telling people to get the vaccine as well. That's what this one says. This is an interesting one. If you've had monoclonal antibody or convalescent plasma, you're supposed to wait 90 days to avoid interference with the immune response. And in congregate settings, anybody who's got a known exposure should just go ahead and get vaccinated. There is no pre-vaccine testing recommended. What doesn't change is we still got to stay masked, social distance, and isolating when necessary. Just because we're not sure until everybody is really vaccinated and we've got enough to get to herd immunity. We're still asking people to keep the same precautions. We don't know how long immunity lasts. And the other thing we don't know is, will it prevent transmission, asymptomatic transmission? We're still watching that. Okay, so we know it'll keep you from getting sick most of the time, but we don't know for sure if it's gonna keep you from transmitting it. Hopefully that will be the case. Okay, I got some stats for you. This is as of today. Total doses administered in New Mexico, 152,984, almost 153,000 doses administered. And we're getting, over the last week, we've been escalating this. We're at about 6,300 doses every day that get out into our populace. So pretty proud of that. I think those are pretty good numbers for us. You'll see that we're still clustered in the younger age group, 16 to 64, 108,000. The 65 to 74 group is another 18,000, and 75 up is another 18,000. I think we need to get those upper age groups in there more, and we're trying to work on that. Here's the race and ethnicity breakout. You can see white is the biggest number, 81,000. Unknown is a really big number, almost 30,000. Native Americans are at 13,000, which is pretty good. And that doesn't count all the Indian Health Services doses. Asians and Blacks, not very high. And then, of course, other races in there and unknown, so who knows what all that means. There's a lot that's really just not identified. All right, why should you get vaccinated? You protect yourself, you protect your family, you protect folks you live with, and any coworkers, and you reduce community spread. So that is my presentation. I hope that was of some interest to you guys, and then we can just talk, and that's probably where more fun will be had. So thank you for your attention.
Thank you, Dan. We had asked people to send in questions. So Michelle, I believe you have a list of questions. So if you want to start with those, that would be great. If you want to unmute yourself.
There we go. Can you hear me?
Yep.
Okay. So here we go. We just have a few. The first one is where the drive-through vaccination sites are in Santa Fe or in Albuquerque or in New Mexico.
So Albuquerque, we've got the big expo site at the state fair. And let's see, Santa Fe, we've got indoors, the Santa Fe High School, but let's see, where do we have? I'm not sure in Santa Fe where the drive-throughs are. I'm actually not up on that. I bet somebody in the crowd does know though. I'm thinking maybe St. Vincent, but I'm just making that up. So don't take my word for that.
Okay. Can you request a specific vaccination type?
You know, you could. I think usually we're asking people to, kind of take what you can get, because it's kind of a lottery ticket. It comes up, you want to kind of, want to kind of go with that. You know, like I said, the Moderna is a little more rough with the side effects. I don't think it's you know, big enough that I would pass it by, though, personally.
Okay. Barbara Frick, who was on this call, said that she got the vaccine and she got the VSafe information, and then she tried to sign on for VSafe and started it, but had not gotten a code that they said would be sent to her phone, and so she did not complete the registration. What should she do?
Huh. Probably try it again. I honestly haven't used the VSafe thing myself, so trying to bet. I bet there's going to also be a help function on the internet there. I would look at that.
Okay. And then are there dates, Dan, for entering into the next phases of vaccination? Or is it clearly depending on how many vaccinations we end up getting?
It's the latter. I mean, we were waiting for 1A to turn into 1B, and the governor's office held out for a while. And, you know, I think they were wise with that finally, because we still have a number of 1A, and they overlap, right? So we're still doing 1A while we're doing 1B. We'll still be doing 1B when we get into 1C, but it's basically once we get up to, you know, a certain percentage of 1B, we'll start rolling over into 1C. It doesn't really help though to get I mean, when you've got this huge number to get through, to just add another group into the line, in my opinion, it's better to sort of get it down to a more manageable number before you move on.
Okay. So if you registered online, but you did not get a confirmation code, should you register again? Should you call?
No, you can't register again. And I mean, basically, it's the thing where I said there's one vaccine for every 10. So, you know, we've got, I think last I heard, over 470,000 people registered in the app. And as you saw, we're at about 150,000 doses. So we're moving through it, but it's still a higher ratio of those that are, you know, in the app waiting. You just got to be patient, and you know, sorry about that.
Okay. And in order to get a vaccine notification, you have to finish your profile on the registration site.
You do. So you can get registered by just putting the initial information in your name, phone number, and address. But to be able to really get called for a vaccine, you have to finish the demographics and the insurance and all those pieces that are in there. So please fill the whole thing till you get the green checks. Get all those green checks.
Okay.
Yeah.
Any ETA on the Johnson & Johnson vaccine becoming available?
Yeah, I think that's going to be next month. They're apparently going for the emergency use authorization either the end of this month or the very beginning of February. Then, you know, it goes through the approval process, which, boy, they're quick on that. So I think we'll have Johnson & Johnson, and we're anticipating that's a 1-dose vaccine. I got to tell you, I want the 1-dose vaccine for homeless shelters, you know, jails, detention centers, that kind, where you might not get that person back very easily. So that's going to be where I would prioritize the use of the Johnson one. But the good thing is, and then AstraZeneca is probably March or late February or March. So what that means is we're going to see more and more supply of vaccine coming up in the next couple months. So it's going to get better.
Okay. And then Dennis Dickinson, who's on the call, wanted people to know if they wanted to register with the VA, you have to call to make an appointment with the VA, and then you have to go to the Albuquerque hospital twice in order to do that. So I guess that's that one. And then what are the anticipated number of doses, if you know, coming into New Mexico in the next month?
So I think we're getting about 30,000 doses a week, 30, 40,000 doses a week now. We're hoping that's going to increase some, and you know, gradually move up from there. So you can sort of figure out there, we're getting maybe close to a couple 100,000 a month, 150 to a couple 100,000 roughly.
Okay. This is my question. I heard I read in the paper today that 30% of healthcare workers in New Mexico are refusing to take the vaccine. Can you talk about what kind of risk that presents to the population as a whole? If you go to a facility to see a healthcare worker and they haven't been vaccinated, how
Right.
are the providers going to deal with that?
Right. Well, unfortunately, we're seeing an overall uptake percentage, across the board around 60%. So there's your 40% not taking it. So if healthcare workers are only passing by 30%, that's better than the general population. So, there are a few healthcare providers that I know are mandating it for their staff, but I don't think most of them are not. One of the issues that came out at the very beginning was an emergency use authorization. It's not a tried and true vaccine that's been around for 10 years or many years, like a measles vaccine, let's say, where you could say, you need to have that, which we don't except in school. So yeah, I mean, there is some risk, but I mean, it's 70% less risky than it was last month. So I guess I would look on the bright side and say the risk has gone down. It's not down to zero. But really, with healthcare workers, I mean, they're wearing the N95s in general, and they're pretty well protected. So I don't think they're your highest risk place in the world to be. And I'm just giving you opinions, folks, but
Okay.
that's how I look at it. Okay.
Right. So I know that there's a real concern among the elderly population of going indoors to take a vaccine. So Dan, if you could find out for us where drive-through sites in Santa Fe might be, maybe you could send those to Ann and she can distribute it out to our membership.
I think Ann just did that, didn't she? Ann, was that you there? You're on mute though.
There we go. No, I haven't sent out, I don't know where the drive-throughs, but
Okay.
honestly, I was at the Santa Fe High School and it's very safe.
I was too. It's so big, it's like
Mhm.
it's closed, but it's big space. So you're talking lots of, but yeah, let me find out where and I'll send it to Ann. I'll get Ann that information about the drive-through. Sorry, I didn't come with that.
That'd be great. So someone asked if Christus was offering the vaccines, but if they are, you still need to get registered, correct?
Yes, you really do still need to get registered. I mean, that's still your ticket is through the
Right.
registration app. Yeah.
And then they can call when they get their notification and get a slot.
Right. Kind of how it works is the healthcare provider can call if they have patients they want to call. They can do that. So they can do their own appointments and fill their own appointments, and some do that. Others actually, like at the expo one in Albuquerque, we do 800 a day some of the days, and we get people out of the registration app, and they kind of randomly grab them. There is a randomization, so it's a bit of a lottery, just to be honest with you, okay? But they're going to try to do it from the 75 on down, and so they're going to pull from the highest risk groups and pull them on in and fill those slots, and it's very efficient. It fills up and gets vaccine out real quick.
That's great. So if you've tested positive and then you have COVID and recover, and then you test again and you're negative, you have antibodies against the virus, but does that mean you don't need the vaccine?
No, we're still recommending you. So you have immunity, and CDC has said, okay, we're looking at immunity as 90 days. Like we can sort of prove that 90 days of immunity after recovery from COVID, but we don't know if it's a year or 6 months or 10 years. We don't know. So it's basically just, it's a second insurance policy. You have it, you don't know how long that protection is, get the vaccine also. So yes, we're
Okay.
recommending everybody get it, recovery or not.
So if someone is over 75 and they've registered, but they haven't received a call to get their vaccine, is there anything they can do to jumpstart it?
I mean, you can try calling your provider or where if you have, access, you can try, sometimes people are able to do that, but by and large, not really. You're just kind of in the waiting room there is the main answer to that.
Okay.
Yeah.
So on your slide, Dan, early in your presentation, you mentioned that, that phase 1C, which is persons over 65, will start in the spring. Is it possible that that could be moved up depending on how many vaccinations come into the state? Or is that sort of a
Again,
best optimistic guess?
it's not like a bright line that, we've got a date. We don't have a date. We're gonna see when we're able to sort of work through our backlog in 1B before we move on to 1C. So, you can see the pace at which we're going. We're getting 6,000 doses a day. I bet we get it up to 10,000, maybe more. We're going to try to get it higher. We're trying to accelerate. There's some big potential. See, right now, the shortage or the bottleneck is supply. It's doses. So like we have UNM, Prez, and somebody else down in Albuquerque ready to do 3,000 a day events. But they can't crank up yet because we just don't have the doses to get to them. And we're also trying to spread the doses around the state, a little equity to the small places and the rural areas. We're getting out to the FQHCs. We're still taking care of the long-term care facilities. So we just don't have the supply to, really crank it up where we'd like it. But, that's going to change. It's going to accelerate for sure. I can guarantee you that. I can't tell you the timing.
Okay. So you might have touched on this in your presentation, but once you get your first vaccination, will they let you know or schedule you for your next one?
Yes.
Okay. So they do that on the spot?
They'll either do it on the spot. They also have, the registration app will send you a reminder. And they'll keep, but they should be they'll hold those second doses. So second doses are a priority. So they won't give away your second dose to a first dose person until they give you your second dose. So there's a number of reminder systems that are in place. But the best is if they just appoint you right away.
Yeah, and you just touched on something that I think had been discussed at the CDC level, and that was holding up the second dose so that a larger population can get the first dose. Is that something New Mexico is looking at?
Well, that's no, that's not the way we're doing it. So the way it was done in the beginning, those second doses were held back by the CDC and by the manufacturers and all that. So they were just saying, well, we just don't think the states are necessarily going to manage this right. So we're going to give you 10,000 doses. And then in another 3 weeks or 4 weeks, depending, we're going to give you 10,000 more doses, plus those other 10,000 that you need for first doses. Now you have those and you can administer them. But see, the state still has to administer them and get them to the right providers at the right time. So here's how it works now. Okay, so let's just say La Familia Medical Center. Okay, we all know that. So they did 5,000 doses last week, and they're getting Moderna product, right? They are. So that's going to be 4 weeks. So what happens is in 4 weeks, they're going to order that 5,000 doses as a second dose order, plus the additional number that they think they can vaccinate in their community. Now, if we have all those, let's say 10,000 doses, we give it to them. If we don't, if we only have 8,000 or 7,000 or 5,000, we're going to give them the 5,000 for the second dose. So again, that's how we prioritize that. And we keep pretty good track of that stuff.
Okay.
Great.
It's a little complicated, folks. I'm just going to tell you.
The other question was someone who has lung damage and who is 80 years old. Is there any way that they can jumpstart their vaccine? Would you suggest they call their provider or?
Yeah, I would. And see if they'll, now most individual, if you have like a private doc, those guys don't necessarily have vaccines yet. It's mostly the bigger organizations, just because it takes a lot of infrastructure and you got to fill out the forms and have the fridges, but they may be able to, influence something at a clinic or something like that. It couldn't hurt. Yeah, I would try that.
So Anne, you posted a phone number on the group chat at St. Vincent. The number is 913-3080, and said that they're getting about 1,000 doses a week.
Right.
So would you suggest that someone call that number if
Well,
they're over 75?
What both Maria and I found out from friends that Christus gets about 1,000 doses a week. And yes, if you call that number, you can possibly get, it is separate from the state registry, because it's, I don't know. Denise got it, a couple of friends of Maria's got it that were older and they had underlying conditions, and they were able to call and get an appointment for vaccine and get vaccinated. So again, just like Dan is saying, a lot of this is really just, man, luck of the draw. You happen to know a number and you call and you get it, or you have a code and you get in. It's really a little bit tough, but I really see that it beats the heck out of parking overnight in a line in Florida.
Right. And, somebody early on asked the question about, if I didn't get a confirmation code, what should I do? And you can't go really any further if you don't have a confirmation code.
Yeah.
So if you've tried to register and they didn't almost immediately get back to you with a code, then you've got a problem that you probably may need to call on or try to do it again, because it's the code that allows you to go back and complete the registration. And it's the code that you need to use when you finally get like an event that you can join. You still need that code. So without the confirmation, you're not going to get there.
Right. And call the hotline. They do have, at the registration, they also have a number, and, it's the, here, let me put it in the chat box. Would that be good?
That'd be great.
Yeah. So you can call them, and here's something we're working on. Like, so, we're conscious that's like, some folks, either elderly folks or, folks that don't have resources or in rural areas, maybe are on the digital divide, right? Don't really have maybe internet capacity, whatever it might be. And so we need to be able to call those people and get them appointments, and we're setting that up. That's an active thing happening right now. So I put that out there now. It's the 855-600-3453. And if you do 0 and then 4, I think are the options, will get you to the registration apps call center.
Okay. So Anne, I think that's all the questions.
Great.
Dan?
Yeah.
Just to confirm, if we have registered and we have a confirmation number, does that mean that we are fully registered, or does it just, is that, so if we have registered and we have a confirmation number, is that the sign to simply wait for the phone to ring and someone will tell us when to come and where to come?
Yeah, so did you put down a text or a email? What did you put down for a contact?
I put both text and email.
Okay,
But I
yeah,
did call this number you gave me,
uh-huh.
3453. It was hopeless. You might as well spend the day in your car listening to this
I'm
thing. So it's
sorry.
useless. That's
We're
okay.
work,
But I'm just, the basic thing is, if we do have the confirmation number, can we believe that we're all set and we just have to wait for the phone to ring?
yes, that's what you do have to do. And I'm really sorry. I know that. Look, the company, the vendors stood up the registration app, but they didn't have a call center. So we told them, hey, you got to put up a call center. They put 6 people in it. I was like, you guys are crazy. I mean, you're gonna get killed, and they did. And so they're getting up to about 40 people now. They're in the mid 30s. So and we're making sure it's manned or personed from all day from 7 days a week. So
And then does it make sense to call the St. Vincent number 913? I forget, I don't have it here, and
Right.
see if they can work us in, or if they have availability, or this or that, or is
You
it
know,
just juggling a few balls here?
yeah, I mean you could try it. I honestly don't know if that's going to get you anywhere. I'm not going to lie to you. I don't know the answer to that. I can tell you that people throughout the state are calling every number possible, emailing every email possible. I mean, we're getting an avalanche of people saying, hey, can I get in? And you're all right. Yeah, you all need to get in. We just don't have the doses right now. So, I mean, I don't know. I don't blame anybody doing anything to try to get it done. I don't blame you. Go for it. Try it. It couldn't hurt.
Got a question?
Thank you.
Mary Here. I heard a rumor that if my husband's 83, I'm 71, and they're saying if spouses have an older spouse, that they should come in the same time. Is that true?
I don't know. I think he's gonna have an appointment and you're not, but they might be extra doses. A lot of times there's extra doses at the end of the day. So it couldn't hurt.
Okay. Thank you.
So Dan, I missed a couple of questions. One was someone expressed some concerns or asked if we should be concerned about a number of deaths that have happened in Sweden with older people.
I am not up on that. I'm going to have to plead ignorance. I had not heard about that one. But I can tell you though, that the phase 3 trials with, over 40,000 people in them, they did elderly people. They got a lot of elderly people. They were specifically worried about, would there be an immune response in elderly people? They got a ton of them in there. So I don't have the numbers for you, but I don't know what to tell you about Sweden. I can tell you it's been really well tested in this country and internationally. So I don't think, I can't comment on the Sweden case though. I'm sorry.
Okay. And then Dennis mentioned that he checks the hotline number every day and asks, is that a good way to see if you can get an appointment?
So the hotline being the number that I just gave you there, the 855, I don't think so. I don't think that's going to do anything, but as far as I know, that's not going to be helpful, but I feel like I don't know any of your guys' answers.
And then another person on the call said, if you don't receive a confirmation code after registering, go to the site and access your registration and then click on don't know your confirmation code. It will allow you to enter your birthday and email or phone number and access your registration.
That's
I'm
great.
so impressed. You guys are awesome. You guys we'll hire you for our call center.
This is a very informed group, and I want to thank, Dan, just tremendously for taking the time, because so much of the information we get is all rumor and maybe this, maybe that. And although it is a terribly uncertain time, it is good to have, just like today, you gave us the statistics for today. That's impressive, and I really, really appreciate your time.
Well, thank you, Ann. I'm happy to be here, and Barrick asked me to, so that, that was my friend there. So thanks, Barrick.
Well,
It's a
So Dan, we
pleasure.
got
You guys are-
one final question.
Sure.
Can you go to a different state to get your vaccine, or do you have to get it in New Mexico?
I mean, you could try. I don't know what their line is like. I don't know how they get people in. I couldn't tell you. I mean, if you know somebody and you have a connection, you can get up there and get it. I mean, like I said, anything you can manage, good luck. But I don't know anything about how they would do it in Colorado. And all I can tell you is we're like number 3 in the country percentage of our doses getting into arms. So, Colorado hasn't got anything on us.
That's great to
Thank
know.
you. Thank you.
Yes, thank you,
Thank you,
Dan, very
Dan.
much.
All right. Thank you,
Awesome.
guys.
Thank you.
Hello?
I'm going to say goodbye.
Very much
Bye.
appreciate
Thank you
your time.
much. Thank you.
Appreciate you.
Thank you, Barrick, for setting this up. We really
Oh,
appreciate it.
pleasure.
It's awesome. It's really hard when you just keep on getting information and more information that is incorrect. And it really is, it is wonderful to hear what's going on. And I know it's frustrating for everybody to try and get in. And I just encourage you, if I send out something and there's a phone number, we've tested it, or we have at least 2 sources that say it's a valid number. So if I send out a number, just get on the phone and see if you can and make an arrangement to get a vaccine. Because like Dan said, it's a lottery right now, and anything you can do to increase your odds on getting your vaccine, I would say go for it.
Anne, can I say something real quick?
Sure.
Okay, Mary Clyde, you had a question about your husband. My friend, she's 80 and her husband is 86. Now she's below 7. I'm sorry, she's below 75 and he's 86. She got an appointment with him. So
Okay.
they allow the spouse, to go with the same time. So she got an appointment for both of them at the same time.
Thank you.
Okay?
And the
The
number
number that I gave you guys, that number, the 913, that's what I was talking about.
the number at St. Vincent now just it goes to a recording that their host system is full and they won't have another clinic until sometime in the future. So
Oh.
it's basically a dead end right now until they open it up again.
Yeah.
Okay.
Like I said, they're only getting about 1,000 doses a week. And according to the Santa Fe Reporter this morning, they already had 4,000 people registered.
Yeah.
Yeah. So we may hear of another one, when it pops up, we'll be certain to send it out.
Thank you.
You're welcome.
Thank you.
Thank you, guys. It was
Thank you.
fantastic.
You're
Very
welcome.
good.
Thank you.
Thanks,
Very
Ann.
good.
Thank
Thank
Bye,
you.
everybody. Have a good rest of the day. Bye, Cammie. Bye, Doug.
Bye.
Bye.
Much.
Good to see y'all.
Bye.
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 Okay, I'm going to end it all for everybody.
Okay.
Bye.
Bye.